Medical Assistant Exam Diagnostic Testing Questions. Question 1. As part of exam preparation in a specialty referral visit, the assistant reinforces instructions for a Holter monitor. Which point is important? Option A. Ignore the return time. Option B. Submerge the monitor in water. Option C. Remove electrodes whenever symptoms occur. Option D. Keep a diary of symptoms and activities as instructed. The correct answer is option D. Keep a diary of symptoms and activities as instructed. A symptom and activity diary helps correlate events with the recorded rhythm. The monitor must be returned as scheduled for data review. Water can damage the device and create safety risks. Removing electrodes can interrupt recording when data are most important. Question 2. During a family practice clinic, the assistant prepares the room for a minor sterile procedure. Which action supports patient dignity? Option A. Leave the patient uncovered until the provider arrives. Option B. Discuss the patient's body in the hallway. Option C. Skip explanations because the patient signed in. Option D. Provide appropriate draping and expose only the area being examined. The correct answer is option D. Provide appropriate draping and expose only the area being examined. Draping preserves privacy and warmth while allowing the provider access to the needed area. Unnecessary exposure reduces dignity and comfort. Public discussion can violate privacy and professionalism. Patients still need respectful communication during preparation. Question 3. After reviewing the situation in an urgent care office, a specimen must be protected from light after collection. Which handling method is appropriate? Option A. Shake the specimen vigorously for 1 minute. Option B. Leave the specimen uncovered at the front desk. Option C. Wrap the specimen in foil or use an amber container as directed. Option D. Place the tube in direct sunlight to warm it. The correct answer is option C. Wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Vigorous shaking can hemolyze blood specimens. Delayed or improper handling can compromise results. Sunlight can degrade light-sensitive specimens. Question 4. During a certification exam scenario, the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A. Platelet. Option B. Alveolus. Option C. Axon. Option D. Ureter. The correct answer is option C. Axon. An axon carries nerve impulses away from the neuron cell body. A platelet is a blood component involved in clotting. An alveolus is a lung air sac. A ureter carries urine from kidney to bladder. Question 5. In a certification exam scenario, the P wave is reviewed on an electrocardiogram. Which event does it represent? Option A. Ventricular depolarization. Option B. Ventricular repolarization. Option C. Atrial depolarization. Option D. Kidney filtration. The correct answer is option C. Atrial depolarization. The P wave represents electrical activation of the atria. Ventricular depolarization is represented mainly by the QRS complex. Ventricular repolarization is represented by the T wave. Kidney filtration is unrelated to electrocardiogram waveforms. Question 6. A medical assistant is working in a quality control review when the assistant scans a signed consent form into the wrong patient's chart. Which action is best? Option A. Report and correct the filing error according to policy. Option B. Leave it because both patients use the same clinic. Option C. Ask the patient to sign a blank form. Option D. Delete the form and tell no one. The correct answer is option A. Report and correct the filing error according to policy. Misfiled records can affect patient care and privacy, so they must be corrected properly. Clinic use does not make one patient's document appropriate in another chart. Blank forms do not correct the misfiled record and are inappropriate. Unreported deletion can worsen the documentation error. Question 7. While working in an outpatient laboratory, the provider asks the assistant to prepare for a visual acuity test. Which tool is commonly used? Option A. Snellen chart. Option B. Hemostat. Option C. Tourniquet. Option D. Autoclave tape. The correct answer is option A. Snellen chart. A Snellen chart is used to screen distance visual acuity. A hemostat clamps tissue or small objects during procedures. A tourniquet helps locate veins for blood collection. Autoclave tape indicates exposure to sterilization conditions. Question 8. As part of exam preparation in an electronic health record review, a reagent bottle is past its expiration date. Which action is appropriate? Option A. Change the expiration date on the label. Option B. Do not use it for patient testing. Option C. Mix it with a new reagent to strengthen it. Option D. Use it only for abnormal patients. The correct answer is option B. Do not use it for patient testing. Expired reagents can produce inaccurate results and should be handled according to policy. Altering dates is unsafe and unethical. Mixing reagents without approval can invalidate testing. Expired reagents are not reliable for any patient testing. Question 9. The care team in an urgent care office asks for guidance because a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A. Sims. Option B. Prone. Option C. Supine. Option D. Fowler. The correct answer is option C. Supine. Supine means lying on the back facing upward. Sims position is side lying with one knee flexed. Prone means lying face down. Fowler position is seated or semi-seated. Question 10. At the start of care in an administrative check-in area, the assistant reviews the normal pacemaker of the heart. Which structure is identified? Option A. Alveolus. Option B. Gallbladder. Option C. Ureter. Option D. Sinoatrial node. The correct answer is option D. Sinoatrial node. The sinoatrial node normally initiates the heart's electrical impulse. An alveolus is a lung air sac. The gallbladder stores bile and is not cardiac conduction tissue. A ureter carries urine from kidney to bladder. Question 11. After reviewing the situation in a diagnostic testing area, a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A. A normal calibration mark only. Option B. Correct limb lead placement. Option C. Poor electrode contact or patient movement. Option D. A properly grounded machine with still patient. The correct answer is option C. Poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Calibration marks do not explain baseline movement during tracing. Correct placement should reduce rather than create artifact. Good grounding and stillness reduce electrical or motion artifact. Question 12. While working in a women's health clinic, a patient has chest hair that prevents electrodes from adhering. Which action is most appropriate? Option A. Ignore loose electrodes if the tracing prints. Option B. Place electrodes over clothing. Option C. Wet the electrodes with tap water only. Option D. Prepare the skin according to protocol to improve electrode contact. The correct answer is option D. Prepare the skin according to protocol to improve electrode contact. Good skin preparation helps electrodes adhere and improves tracing quality. Loose electrodes can create artifact and poor quality results. Electrodes must contact skin to record electrical activity. Unapproved moisture does not replace proper skin preparation. Question 13. A medical assistant is working in an exam room when the QRS complex is reviewed on an electrocardiogram. Which event does it mainly represent? Option A. Ventricular filling with blood only. Option B. Lung gas exchange. Option C. Atrial repolarization only as the visible main event. Option D. Ventricular depolarization. The correct answer is option D. Ventricular depolarization. The QRS complex represents electrical activation of the ventricles. Mechanical filling is not the primary electrical event represented by QRS. Gas exchange occurs in the alveoli, not on the QRS waveform. Atrial repolarization is usually hidden within the QRS complex. Question 14. As part of exam preparation in a patient intake station, a multi-dose vial has no date after being opened. Which action is most appropriate? Option A. Follow facility policy and do not use it if safety cannot be verified. Option B. Use it because the cap is still attached. Option C. Mix it with another vial to avoid waste. Option D. Guess the opening date from memory. The correct answer is option A. Follow facility policy and do not use it if safety cannot be verified. Opened multi-dose vials require proper dating and storage to support medication safety. The cap does not prove when the vial was opened or whether it was stored correctly. Combining vials can contaminate medication and is not appropriate. Guessing creates unsafe documentation. Question 15. To protect safety in a telephone triage workflow, a patient asks which body system includes the skin. Which system should be identified? Option A, urinary system. Option B, endocrine system. Option C, integumentary system. Option D, respiratory system. The correct answer is option C, integumentary system. The integumentary system includes the skin, hair, nails, and related glands. The urinary system filters blood and eliminates urine. The endocrine system is made of hormone-producing glands. The respiratory system supports breathing and gas exchange. Question 16. In a preventive care visit, a subpoena for medical records arrives at the office. Which response is best? Option A, immediately fax the entire chart without review. Option B, give it to the provider or designated privacy officer for proper handling. Option C, ignore it because subpoenas never apply to clinics. Option D, ask the receptionist to summarize the chart from memory. The correct answer is option B, give it to the provider or designated privacy officer for proper handling. Legal requests for records should be reviewed through office policy before information is released. Records should not be released without verifying legal requirements and scope. Subpoenas can require action and should not be ignored. Summaries from memory are unreliable and not an appropriate legal response. Question 17. Given the workflow in an internal medicine office, a claim requires the code for an office visit procedure or service. Which code set is used? Option A, CPT. Option B, ICD-10-CM. Option C, policy number. Option D, zip code. The correct answer is option A, CPT. CPT codes describe medical procedures and professional services. ICD-10-CM codes describe diagnoses and reasons for services. A policy number identifies insurance coverage and does not describe the service. A zip code identifies location and is not a procedure code. Question 18. For a patient encounter in a primary care office, a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A, make an addendum according to office policy. Option B, ask a coworker to change it under their login. Option C, ignore the error even if it affects care. Option D, delete the original note completely. The correct answer is option A, make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Using another person's login violates accountability. Clinically important errors should be corrected through proper procedures. Deleting a signed record can destroy the audit trail. Question 19. To protect safety in an exam room, a voicemail must be left for a patient according to office policy. Which message is safest? Option A, leave limited information and a callback number. Option B, leave another patient's results for comparison. Option C, demand payment details with full medical history. Option D, describe the diagnosis in detail on the message. The correct answer is option A, leave limited information and a callback number. Limited voicemail content reduces the risk of exposing health information to others. Sharing another patient's information is a privacy breach. Excessive information violates privacy and may not be necessary. Detailed clinical information may be heard by unauthorized people. Question 20. A medical assistant is working in a certification exam scenario when a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A, use latex-free supplies and clearly communicate the allergy. Option B, tell the patient to bring personal gloves only. Option C, use powdered latex gloves because they are easier to put on. Option D, ignore the allergy if the procedure is short. The correct answer is option A, use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. The clinic remains responsible for preparing a safe care environment. Latex gloves can trigger a reaction in a latex allergic patient. Even brief latex exposure can cause a serious reaction. Question 21. After reviewing the situation in a diagnostic testing area, a chain of custody urine drug screen is collected. Which practice is most important? Option A, use an unlabeled container until the lab receives it. Option B, allow the patient to take the specimen home first. Option C, document each transfer and maintain specimen integrity. Option D. Skip signatures if the specimen looks normal. The correct answer is option C. Document each transfer and maintain specimen integrity. Chain of custody documents who handled the specimen from collection through testing. Unlabeled specimens can be rejected and cannot be reliably traced. Uncontrolled possession breaks specimen integrity. Appearance does not replace custody documentation. Question 22. To protect safety in a patient intake station, a coworker asks to view a neighbor's chart out of curiosity. Which response is appropriate? Option A. Deny the request because there is no job-related need to know. Option B. Open the chart if the coworker promises not to tell anyone. Option C. Print the chart and remove the patient's name only. Option D. Share the chart because staff work in the same clinic. The correct answer is option A. Deny the request because there is no job-related need to know. Access to protected health information must be limited to legitimate work-related purposes. A promise does not create a permitted reason for access. De-identified information must meet specific standards and curiosity is not permitted access. Employment at the same clinic does not automatically authorize chart access. Question 23. As part of exam preparation in a diagnostic testing area, the term tachypnea appears on an intake form. Which meaning is correct? Option A. Rapid breathing. Option B. Low temperature. Option C. Slow pulse. Option D. Painful urination. The correct answer is option A. Rapid breathing. Tachy means fast, and nea relates to breathing. Low temperature is hypothermia. Slow pulse is bradycardia. Painful urination is dysuria. Question 24. Given the workflow in a family practice clinic, the term otitis media is listed in the assessment. Which body area is involved? Option A. Middle ear. Option B. Kidney. Option C. Stomach. Option D. Liver. The correct answer is option A. Middle ear. Otitis media refers to inflammation or infection involving the middle ear. Kidney inflammation is related to nephritis or pyelonephritis. Stomach inflammation is gastritis. Liver inflammation is hepatitis. Question 25. The care team in a certification exam scenario asks for guidance because a patient must pay a percentage of the allowed charge after the deductible is met. Which term applies? Option A. Referral. Option B. Copayment. Option C. Coinsurance. Option D. A remittance address. The correct answer is option C. Coinsurance. Coinsurance is the patient's percentage share of covered costs. A referral is permission or direction to see another provider. A copayment is usually a fixed amount rather than a percentage. A remittance address tells where payments or documents are sent. Question 26. As part of exam preparation in a medical office workflow, a disinfectant label lists a 10-minute wet contact time. Which action is necessary? Option A. Wipe the surface dry immediately. Option B. Keep the surface wet for the full listed contact time. Option C. Use the disinfectant only on clean hands. Option D. Dilute the solution more to reduce odor. The correct answer is option B. Keep the surface wet for the full listed contact time. Disinfectants need the manufacturer's required contact time to achieve the intended level of microbial kill. Removing the disinfectant too soon can make it ineffective. Environmental disinfectants are not hand hygiene products. Unapproved dilution can reduce disinfectant strength. Question 27. When a patient encounter unfolds in a walk-in clinic, blood flow stops during a venipuncture after the tube begins filling. Which action is most appropriate? Option A. Remove the tourniquet and continue filling all tubes. Option B. Label the empty tube as collected. Option C. Gently adjust the needle position while maintaining safety. Option D. Probe aggressively until blood returns. The correct answer is option C. Gently adjust the needle position while maintaining safety. A small adjustment may restore blood flow if the bevel is against the vein wall. Without blood flow, the collection cannot continue effectively. A tube without the required specimen must not be labeled as completed. Excessive probing can injure tissue and increase patient discomfort. Question 28. For a patient encounter in a patient education session, the assistant is exposed to a needle stick from a used needle. Which action should occur first? Option A. Place a bandage on the site and ignore it. Option B. Wash the area and report the exposure according to protocol. Option C. Finish all remaining patients before telling anyone. Option D, hide the incident if there is no bleeding. The correct answer is option B. Wash the area and report the exposure according to protocol. Immediate cleansing and prompt reporting start the exposure management process. Covering the wound alone does not address exposure risk. Delaying reporting can delay needed evaluation and follow-up. A needle stick can transmit bloodborne pathogens even with minimal visible injury. Question 29. While working in a preventive care visit, a patient has been drinking hot coffee immediately before an oral temperature. Which action should the medical assistant take? Option A, switch to a rectal temperature without asking. Option B, record the temperature as normal without measuring it. Option C, wait according to office protocol before measuring the oral temperature. Option D, take the temperature immediately because oral readings are unaffected. The correct answer is option C, wait according to office protocol before measuring the oral temperature. Hot or cold intake can temporarily alter oral temperature and lead to an inaccurate reading. Changing to an invasive route requires proper indication and protocol. Vital signs must be measured rather than assumed. Recent liquids can affect oral temperature results. Question 30. When a patient encounter unfolds in a clinical skills review, the suffix ectomy appears in a procedure term. Which meaning is most accurate? Option A, visual examination. Option B, surgical removal. Option C, abnormal softening. Option D, inflammation. The correct answer is option B, surgical removal. Ectomy means surgical removal of a structure. Visual examination is often indicated by scopy. Abnormal softening is indicated by malacia. Inflammation is indicated by itis. Question 31. The care team in a preventive care visit asks for guidance because the term hypertension appears in the problem list. Which meaning is correct? Option A, high blood pressure. Option B, slow breathing. Option C, joint inflammation. Option D, low blood glucose. The correct answer is option A, high blood pressure. Hypertension means blood pressure above the normal range or treatment threshold identified by the provider. Slow breathing is bradypnea. Joint inflammation is arthritis. Low blood glucose is hypoglycemia. Question 32. Before the visit continues in an internal medicine office, a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A, ask other patients to help verify the record. Option B, state the full diagnosis loudly to confirm the visit. Option C, speak quietly and avoid announcing sensitive details. Option D, place all charts open on the counter. The correct answer is option C, speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Other patients should not be involved in private verification. Announcing diagnoses in public can violate confidentiality. Open charts may expose protected information. Question 33. Following office protocol in a patient intake station, a fax containing patient information must be sent to another facility. Which step reduces privacy risk? Option A, leave the fax confirmation on a public counter. Option B, include unrelated patient charts in the same fax. Option C, send it to a number from memory without checking. Option D, verify the recipient fax number before sending. The correct answer is option D, verify the recipient fax number before sending. Verifying the destination helps prevent disclosure to the wrong recipient. Confirmation pages may contain protected information and should be handled securely. Only necessary information should be disclosed. Memory errors can lead to misdirected protected information. Question 34. When a patient encounter unfolds in a primary care office, a claim is denied because patient insurance information was outdated. Which front office process helps prevent this issue? Option A, verify insurance eligibility at each visit according to policy. Option B, skip registration for returning patients forever. Option C, use the oldest card in the file without asking. Option D, code every visit as preventive care. The correct answer is option A, verify insurance eligibility at each visit according to policy. Eligibility verification helps identify coverage changes before claims are submitted. Returning patients can have changed insurance or contact information. Old cards may no longer reflect active coverage. Coding must reflect the service and documentation. Question 35. A medical assistant is working in a busy front office when a sterile dressing change is being prepared. Which action helps maintain sterility? Option A. Reach across the field with unsterile clothing. Option B. Open sterile supplies without touching the inner sterile surface. Option C. Place sterile gauze on an unclean counter. Option D. Reuse sterile gloves from a previous patient. The correct answer is option B. Open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. Reaching over the field can contaminate it. An unclean surface contaminates sterile supplies. Sterile gloves are single-use and patient-specific. Question 36. After reviewing the situation in an exam room, the assistant prepares instruments for suture removal. Which item is commonly needed? Option A. Ophthalmoscope only. Option B. Suture removal scissors or sterile scissors according to policy. Option C. Tuning fork only. Option D. Peak flow meter only. The correct answer is option B. Suture removal scissors or sterile scissors according to policy. Suture removal requires an appropriate cutting instrument and aseptic supplies according to the procedure. An ophthalmoscope is used to examine the eye, not remove sutures. A tuning fork may be used in hearing or vibration tests. A peak flow meter measures expiratory airflow and does not remove sutures. Question 37. In a same-day appointment, the provider asks for an instrument to examine the retina. Which instrument should be prepared? Option A. Ophthalmoscope. Option B. Reflex hammer. Option C. Otoscope. Option D. Centrifuge. The correct answer is option A. Ophthalmoscope. An ophthalmoscope is used to view internal eye structures such as the retina. A reflex hammer tests reflexes and does not visualize the retina. An otoscope is used for the ear canal and tympanic membrane. A centrifuge separates specimen components and is not an eye exam tool. Question 38. An office review in a treatment room shows that a prothrombin time test is ordered. Which tube should be selected? Option A. Lavender tube. Option B. Gray tube. Option C. Blood culture bottle only. Option D. Light blue tube. The correct answer is option D. Light blue tube. Coagulation tests such as prothrombin time require sodium citrate in a light blue tube. Lavender EDTA is used for hematology and can interfere with coagulation testing. Gray fluoride oxalate is not the standard additive for coagulation studies. Blood cultures detect microorganisms and are not used for prothrombin time testing. Question 39. Given the workflow in an electronic health record review, the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A. Store it in a desk drawer overnight. Option B. Maintain required temperature storage and check expiration before use. Option C. Use it after expiration if it looks clear. Option D. Place it in direct sunlight to warm quickly. The correct answer is option B. Maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Room temperature storage can damage refrigerated products. Appearance does not prove potency after expiration. Sunlight and heat can damage the product. Question 40. Given the workflow in a certification exam scenario, a patient is placed lying face down for a back examination. Which position is being used? Option A. Fowler. Option B. Lithotomy. Option C. Prone. Option D. Supine. The correct answer is option C. Prone. Prone means lying on the abdomen with the face downward. Fowler is a seated or semi-seated position. Lithotomy involves legs in stirrups for certain pelvic procedures. Supine means lying on the back. Question 41. After reviewing the situation in an infection control audit, a patient has an irregular pulse during routine vital signs. Which measurement method is most appropriate? Option A. Use the patient's previous pulse from the chart. Option B. Count for 10 seconds and multiply by 6. Option C. Count the pulse for a full 60 seconds. Option D. Skip the pulse and record not available. The correct answer is option C. Count the pulse for a full 60 seconds. An irregular rhythm requires a full minute count to improve accuracy. Old values do not represent the current clinical status. Short counts are less reliable when the rhythm is irregular. The findings should be measured and reported rather than skipped. Question 42. As part of exam preparation in a women's health clinic, A centrifuge is used in the laboratory. Which safety practice is important? Option A, stop the rotor with a hand. Option B, balance tubes before starting the centrifuge. Option C, place only one tube at any weight in the rotor. Option D, open the lid while it is spinning. The correct answer is option B, balance tubes before starting the centrifuge. Balancing tubes helps prevent vibration, breakage, and equipment damage. Stopping a rotor manually is dangerous. Unbalanced loads can damage the machine or specimens. Opening a spinning centrifuge is unsafe. Question 43. When a patient encounter unfolds in a primary care office, a provider orders spirometry in the office. Which patient action is required? Option A, follow instructions for a strong, complete breathing maneuver. Option B, hold both nostrils and refuse to exhale. Option C, remove the mouthpiece before starting. Option D, talk continuously during the maneuver. The correct answer is option A, follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. The test depends on controlled breathing through the device. The mouthpiece is needed to measure airflow. Talking interferes with airflow measurement. Question 44. When a patient encounter unfolds in a women's health clinic, a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A, leave the tube unmixed until pickup. Option B, gently invert the tube the required number of times. Option C, shake the tube forcefully. Option D, open the tube and stir with a swab. The correct answer is option B, gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Failure to mix may cause clotting or poor specimen quality. Forceful shaking can cause hemolysis and inaccurate results. Opening the tube can contaminate the specimen and expose staff. Question 45. An office review in an exam room shows that a specimen label is missing after collection. Which action is best? Option A, send the tube with no label and explain later. Option B, ask another patient if the tube belongs to them. Option C, follow facility policy for recollection or correction without guessing. Option D, write a name on the tube from memory. The correct answer is option C, follow facility policy for recollection or correction without guessing. Unlabeled specimens create patient identification risk and must be managed according to policy. Laboratories commonly reject unlabeled specimens. Patients cannot resolve specimen identity errors reliably. Guessing can cause a serious misidentification error. Question 46. During a family practice clinic, the assistant needs to keep provider meeting time unavailable for patient appointments. Which scheduling tool is useful? Option A, sterile field setup. Option B, matrix blocking. Option C, order of draw. Option D, coinsurance posting. The correct answer is option B, matrix blocking. Matrix blocking reserves time in the schedule for meetings, procedures, or other unavailable periods. Sterile field setup supports clinical procedures, not schedule blocking. Order of draw guides blood collection sequence. Coinsurance posting relates to patient financial responsibility. Question 47. To protect safety in a preventive care visit, a medication order is present but the patient reports an allergy to the drug. Which action should occur before administration? Option A, hold the medication and notify the provider. Option B, administer the medication because it was ordered. Option C, ask the patient to sign a form and give it anyway. Option D, change the medication to another drug independently. The correct answer is option A, hold the medication and notify the provider. A reported allergy is a safety concern that must be clarified before giving the medication. An order does not override a possible allergy. A form does not make an unsafe medication appropriate. Medical assistants do not independently substitute medications. Question 48. For a patient encounter in a busy front office, the assistant removes gloves after contact with blood-contaminated gauze. Which action should follow immediately? Option A, apply lotion instead of cleaning hands. Option B, use the same gloves to clean the next room. Option C, perform hand hygiene. Option D, place the gloves in a regular drawer. The correct answer is option C, perform hand hygiene. Hand hygiene after glove removal reduces the chance of transmitting microorganisms from contaminated gloves. Lotion does not replace hand hygiene. Gloves are task-specific and should not be reused between patients or areas. Used gloves are contaminated waste and should be discarded properly. Question 49. At the start of care in a clinical skills review, the provider discusses the function of white blood cells. Which role is most accurate? Option A, help defend against infection. Option B, produce insulin in the pancreas. Option C, carry oxygen as their primary job. Option D, store bile for digestion. The correct answer is option A, help defend against infection. White blood cells are immune cells that help protect the body from infection. Insulin production occurs in pancreatic beta cells, not white blood cells. Oxygen transport is mainly the role of red blood cells. Bile storage is a gallbladder function. Question 50. Given the workflow in an infection control audit, the patient asks why they must lie still during an electrocardiogram. Which explanation is best? Option A, movement can create artifact that makes the tracing harder to interpret. Option B, electrodes are used only to deliver medication. Option C, movement changes the patient's blood type. Option D, the machine cannot record any heartbeat unless the patient holds breath for 5 minutes. The correct answer is option A. Movement can create artifact that makes the tracing harder to interpret. Stillness improves the quality of the electrical recording. Electrodes detect electrical activity and do not deliver medication during a standard recording. Movement has no effect on blood type. Normal breathing is usually allowed, but excessive movement should be avoided. Question 51. As part of exam preparation in a patient intake station, a subcutaneous injection is ordered. Which site is commonly appropriate? Option A, directly into a vein. Option B, into an area that is bruised and inflamed. Option C, abdomen with adequate subcutaneous tissue. Option D, deep into the deltoid muscle only. The correct answer is option C, abdomen with adequate subcutaneous tissue. Subcutaneous injections are placed into fatty tissue, and the abdomen is a common site when appropriate. Intravenous administration is a different route and is outside a subcutaneous injection. Bruised or inflamed tissue should generally be avoided. The deltoid muscle is an intramuscular site, not a routine subcutaneous site. Question 52. For a patient encounter in a walk-in clinic, a patient with diabetes is scheduled for fasting laboratory work. Which action is appropriate? Option A, cancel the test because diabetes always prevents fasting labs. Option B, review fasting instructions and route medication questions to the provider. Option C, tell the patient fasting means no restrictions at all. Option D, tell the patient to stop all diabetes medications without provider input. The correct answer is option B. Review fasting instructions and route medication questions to the provider. Fasting instructions can be reinforced, while medication adjustments require provider guidance. Diabetes requires careful instructions but does not automatically cancel testing. Fasting usually includes specific limits on food and drink. Medication changes can be unsafe without provider direction. Question 53. After reviewing the situation in an administrative check-in area, an intradermal test is being prepared. Which description matches the route? Option A, medication placed into the ear canal. Option B, injection into deep muscle tissue. Option C, injection just under the epidermis to form a small wheal. Option D, medication swallowed by mouth. The correct answer is option C, injection just under the epidermis to form a small wheal. Intradermal injections are shallow and often create a small bleb or wheal. Ear canal administration is otic. Deep muscle injection is intramuscular. Swallowed medication is oral administration. Question 54. Given the workflow in a preventive care visit, a child needs a height and weight recorded for medication dosing. Which documentation practice is safest? Option A, record height only because weight changes often. Option B, use the parent's estimate if the scale is nearby. Option C, round weight to the nearest 10 pounds. Option D, record the measurements using the unit required by the office protocol. The correct answer is option D, record the measurements using the unit required by the office protocol. Accurate units are essential because dosing and growth assessment can depend on precise measurements. Both height and weight may be needed for clinical assessment. Estimated weight is less reliable than a measured value. Large rounding errors can create unsafe dose calculations. Question 55. To protect safety in an outpatient laboratory, the provider mentions the largest artery in the body. Which vessel is being described? Option A, carotid vein. Option B, pulmonary vein. Option C, vena cava. Option D, aorta. The correct answer is option D, aorta. The aorta is the main artery carrying blood from the left ventricle to systemic circulation. Carotid structures are in the neck, but the carotid artery is not the largest artery. Pulmonary veins return blood from the lungs to the heart. The vena cava is a large vein returning blood to the heart. Question 56. Before the visit continues in a same-day appointment, an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A, tell the patient that hypertension has been diagnosed. Option B, send the patient home to rest without notifying anyone. Option C, recheck using proper technique and report the finding according to protocol. Option D, erase the value because it may worry the patient. The correct answer is option C, recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Medical assistants do not diagnose conditions based on one reading. Abnormal readings require appropriate follow-up rather than dismissal. Accurate documentation is required even when the value is abnormal. Question 57. At the start of care in a busy front office, a patient asks for printed medication instructions. Which practice improves health literacy? Option A, provide instructions in the wrong language. Option B, tell the patient to search online without guidance. Option C, use only complex medical terminology. Option D, use clear language and review the key points with the patient. The correct answer is option D, use clear language and review the key points with the patient. Plain language and review help patients understand and follow instructions. Language mismatch can prevent safe understanding. Unguided online searching may provide inaccurate or confusing information. Complex terms can reduce comprehension. Question 58. The care team in a walk-in clinic asks for guidance because a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A, tell the patient the exact diagnosis without provider review. Option B, discard the result because it is abnormal. Option C, notify the provider or designated clinical staff promptly. Option D, file the result for review at the end of the month. The correct answer is option C, notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Diagnosis and interpretation belong to the provider. Abnormal results must be reported, not discarded. Delaying a critical result can put the patient at risk. Question 59. Given the workflow in an exam room, the assistant removes soiled dressings from a wound. Which practice is appropriate? Option A, place the dressing on the clean supply tray. Option B, use gloves and dispose of the dressing according to biohazard policy. Option C, handle the dressing with bare hands. Option D, save the dressing in the patient's purse. The correct answer is option B, use gloves and dispose of the dressing according to biohazard policy. Soiled dressings can contain blood or body fluids and require barrier protection and proper disposal. Soiled material can contaminate clean supplies. Bare hand contact increases exposure risk. Biohazard waste should not be sent home in personal belongings. Question 60. Following office protocol in a family practice clinic, a patient asks for a copy of their medical record. Which action should the assistant take? Option A, follow the office release of information process. Option B, delete sensitive information before the request is reviewed. Option C, give the record to anyone who asks. Option D, refuse because records belong only to the provider. The correct answer is option A, follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Altering the record is inappropriate and may violate legal requirements. Identity and authorization must be verified before disclosure. Patients have rights to access their health information under applicable rules. Question 61. During an exam room, a patient is scheduled for an electrocardiogram and asks whether it will shock them. Which response is accurate? Option A, the test shocks every patient to start the heart. Option B, the electrodes inject medication. Option C, The machine draws blood through the wires. Option D. The test records electrical activity and does not deliver a shock. The correct answer is option D. The test records electrical activity and does not deliver a shock. A standard electrocardiogram is a recording test, not a treatment shock. A standard electrocardiogram does not deliver electrical therapy. Electrodes record signals and do not inject medication. Electrocardiogram leads do not collect blood. Question 62. When a patient encounter unfolds in a quality control review, the assistant is checking the electrocardiogram standardization mark. Which setting is commonly expected? Option A, 25 mm per millivolt. Option B, 1 mm per millivolt. Option C, 10 mm per millivolt. Option D, 100 mm per millivolt. The correct answer is option C, 10 mm per millivolt. Standard electrocardiogram calibration is commonly 10 mm per millivolt. That value is not the common standard amplitude calibration. That calibration would make complexes appear too small for standard interpretation. That value would greatly exaggerate waveform size. Question 63. An office review in a certification exam scenario shows that the provider discusses gas exchange in the lungs. Which structure is primarily responsible? Option A, villi. Option B, tendons. Option C, ureters. Option D, alveoli. The correct answer is option D, alveoli. Alveoli are tiny air sacs where oxygen and carbon dioxide are exchanged. Villi increase absorption in the small intestine. Tendons connect muscle to bone. Ureters carry urine from the kidneys to the bladder. Question 64. To protect safety in a clinical skills review, a provider orders a medication using an abbreviation on the unsafe abbreviation list. Which action should the medical assistant take? Option A, ignore the medication order completely without communication. Option B, clarify the order before proceeding. Option C, interpret the abbreviation however it seems most likely. Option D, ask another patient what the abbreviation means. The correct answer is option B, clarify the order before proceeding. Unsafe or unclear medication orders must be clarified to prevent misinterpretation. The order should be clarified rather than silently ignored. Guessing can lead to serious medication errors. Patients are not appropriate sources for interpreting orders. Question 65. A medical assistant is working in a medication administration visit when the bladder of a blood pressure cuff is not centered over the brachial artery. Which issue may occur? Option A. The reading may be inaccurate. Option B. The pulse oximeter will stop working. Option C. The oral temperature will decrease. Option D. The patient will automatically faint. The correct answer is option A. The reading may be inaccurate. Proper cuff placement over the brachial artery is needed for accurate auscultation. Blood pressure cuff alignment does not control the pulse oximeter. Cuff placement does not change oral temperature. Incorrect cuff placement can be uncomfortable but does not automatically cause syncope. Question 66. Before the visit continues in a medication administration visit, a provider orders a capillary blood glucose test. Which site preparation is important? Option A, use the first visibly dirty drop for every test. Option B, clean and dry the puncture site according to protocol. Option C, puncture through visible dirt. Option D, skip patient identification because the test is quick. The correct answer is option B, clean and dry the puncture site according to protocol. Cleaning and drying the site reduces contamination and supports accurate capillary testing. Site contaminants can affect the first drop depending on protocol. Contamination can affect the sample and infection risk. Patient identification is required even for quick point-of-care tests. Question 67. A medical assistant is working in a community health clinic when a standard electrocardiogram is ordered for a patient with lotion on the chest. Which action improves electrode adhesion? Option A, use tape only and skip electrodes. Option B, apply electrodes directly over lotion. Option C, clean and dry the skin before applying electrodes. Option D, move all chest leads to the abdomen. The correct answer is option C, clean and dry the skin before applying electrodes. Oil or lotion can prevent proper electrode contact and should be removed according to protocol. Tape cannot record cardiac electrical activity. Poor adhesion can cause artifact or lead loss. Incorrect lead placement changes the tracing and may impair interpretation. Question 68. Given the workflow in a medical office workflow, a payer sends money with a remittance advice. What does the remittance advice explain? Option A. How the claim was processed and paid or denied. Option B. How to sterilize forceps. Option C. Where to place EKG chest leads. Option D. Which vaccine lot is expired. The correct answer is option A. How the claim was processed and paid or denied. Remittance advice provides payment, denial, adjustment, and reason information for claims. Sterilization instructions are not part of remittance advice. Electrocardiogram placement is unrelated to insurance remittance. Vaccine inventory is not the purpose of remittance advice. Question 69. While working in a certification exam scenario, a pregnancy test performed in the office is classified as waived testing. Which requirement still applies? Option A. Use expired kits if the package is unopened. Option B. Follow manufacturer instructions and quality control policy. Option C. Skip controls because waived means unregulated. Option D. Report results before the test develops. The correct answer is option B. Follow manufacturer instructions and quality control policy. Waived tests are simple, but they still require correct procedure, controls, and documentation. Expired test kits may give unreliable results. Waived status does not eliminate quality responsibilities. Reading before the correct time can produce inaccurate results. Question 70. An office review in an urgent care office shows that the medical assistant is measuring respirations after counting the pulse. Which technique helps obtain the most accurate result? Option A. Count for 5 seconds and multiply by 12. Option B. Ask the patient to breathe as deeply as possible. Option C. Count respirations while the patient is unaware of the measurement. Option D. Record the respiratory rate from the last visit. The correct answer is option C. Count respirations while the patient is unaware of the measurement. Patients may change breathing patterns if they know respirations are being counted. Very short counts are often inaccurate for respirations. Deep breathing changes the normal respiratory rate and effort. Current respirations must be measured during the encounter. Question 71. In an infection control audit, a patient is suspected of having tuberculosis. Which type of precautions is most appropriate? Option A. Airborne precautions. Option B. Contact precautions only. Option C. Droplet precautions only. Option D. Reverse isolation for staff protection only. The correct answer is option A. Airborne precautions. Tuberculosis can spread through airborne particles and requires airborne precautions with appropriate respiratory protection. Contact precautions focus on direct or indirect touch transmission and are not enough for tuberculosis. Droplet precautions do not address smaller airborne particles that can remain suspended. Reverse isolation protects immunocompromised patients rather than controlling tuberculosis spread. Question 72. For a patient encounter in a busy front office, an insurance plan requires approval before a specialist visit. Which process is being described? Option A. Autoclaving. Option B. Prior authorization or referral process. Option C. Venipuncture. Option D. Auscultation. The correct answer is option B. Prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Autoclaving sterilizes instruments and is unrelated to payer approval. Venipuncture is blood collection and does not authorize insurance coverage. Auscultation is listening to body sounds and does not approve visits. Question 73. At the start of care in a primary care office, the suffix itis appears in a medical term. Which meaning is most accurate? Option A. Inflammation. Option B. Removal. Option C. Pain. Option D. Study of. The correct answer is option A. Inflammation. The suffix itis generally means inflammation. Removal is commonly indicated by the suffix ectomy. Pain is commonly indicated by the suffix algia. Study of is commonly indicated by the suffix logi. Question 74. In a treatment room, a pulmonary function test is scheduled. Which patient instruction may be relevant according to protocol? Option A. Eat a heavy meal immediately before every test. Option B. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Option C. Wear tight clothing that restricts breathing. Option D. Ignore all provider instructions about inhalers. The correct answer is option B. Follow pretest directions about inhalers, smoking, and effort during breathing maneuvers. Pulmonary testing depends on patient preparation and proper effort during the test. A heavy meal may interfere with comfortable breathing for some tests. Restrictive clothing can interfere with respiratory effort. Medication instructions should follow the provider or testing protocol. Question 75. For a patient encounter in a telephone triage workflow, a waived glucose meter control result is outside the acceptable range. Which action is required before patient testing? Option A. Change the patient's diagnosis to match the meter. Option B. Resolve the quality control problem according to protocol. Option C. Use the meter because patient samples are different. Option D. Record patient results without documenting controls. The correct answer is option B. Resolve the quality control problem according to protocol. Out-of-range controls mean the system may not be reliable for patient results. Medical assistants do not diagnose and should not alter clinical information to fit a device. Failed controls must be addressed before reporting patient values. Quality control documentation is part of reliable testing. Question 76. The care team in a medication administration visit asks for guidance because a patient says they feel chest pressure while the electrocardiogram is being prepared. Which action should the medical assistant take? Option A. Notify the provider immediately and follow emergency protocol. Option B. Ask the patient to drive to another clinic. Option C. Complete all paperwork before telling anyone. Option D. Tell the patient it is probably anxiety. The correct answer is option A. Notify the provider immediately and follow emergency protocol. Chest pressure may indicate a serious condition and requires prompt clinical attention. Potential cardiac symptoms should be handled through established emergency procedures. Administrative tasks should not delay reporting possible cardiac symptoms. Medical assistants should not diagnose the cause of chest pressure. Question 77. As part of exam preparation in an infection control audit, a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A. Leave the old pharmacy because it is already in the chart. Option B. Delete all pharmacy information from the record. Option C. Update the preferred pharmacy after verifying the new information. Option D. Choose the pharmacy closest to the clinic. The correct answer is option C. Update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. Outdated demographic information can delay medication access. Removing needed information can interrupt prescribing workflows. The preferred pharmacy should come from the patient rather than staff convenience. Question 78. Given the workflow in a same-day appointment, a minor arrives without a parent for a non-urgent visit. Which action is best? Option A. Follow state law and office policy for consent requirements. Option B. Assume all minors can consent to every service. Option C. Refuse all care without considering exceptions. Option D. Ask another patient in the waiting room to consent. The correct answer is option A. Follow state law and office policy for consent requirements. Consent rules for minors vary by situation and jurisdiction, so policy must be followed. Minor consent is not universal for all services. Some laws allow minors to consent for certain services. Other patients cannot provide consent for the minor. Question 79. As part of exam preparation in a community health clinic, the assistant reviews where bile is stored before release into the small intestine. Which organ stores bile? Option A. Spleen. Option B. Bladder. Option C. Pancreas. Option D. Gallbladder. The correct answer is option D. Gallbladder. The gallbladder stores and concentrates bile made by the liver. The spleen is involved in immune and blood cell functions. The urinary bladder stores urine, not bile. The pancreas produces digestive enzymes and hormones but does not store bile. Question 80. Before the visit continues in a busy front office, a pelvic examination is scheduled. Which patient position is commonly used? Option A. Lithotomy. Option B. Prone. Option C. Trendelenburg. Option D. Sims. The correct answer is option A. Lithotomy. The lithotomy position is commonly used for pelvic examinations. Prone means lying face down and is not the common pelvic exam position. Trendelenburg places the head lower than the feet and is not the routine pelvic exam position. Sim's position is often used for rectal procedures or enemas. Question 81. During a cardiology practice, muscle tremor artifact appears on an electrocardiogram tracing. Which intervention may improve the tracing? Option A. Ask the patient to tense all muscles. Option B. Place the paper speed at 0. Option C. Help the patient relax and support the limbs. Option D. Remove all electrodes during the recording. The correct answer is option C. Help the patient relax and support the limbs. Muscle tension and movement can create artifact, so comfort and support may improve tracing quality. Tensing muscles increases electrical artifact. Paper movement is needed to record the waveform. Electrodes are required to capture the tracing. Question 82. Following office protocol in a telephone triage workflow, an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A. Abandonment. Option B. Beneficence. Option C. Respondeat superior. Option D. Patient autonomy. The correct answer is option D. Patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Abandonment involves ending care without proper notice or support. Beneficence means acting for the patient's good but does not override a competent refusal. Respondeat superior concerns employer responsibility for employee actions. Question 83. As part of exam preparation in an outpatient laboratory, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A. Pull the patient by the arms quickly. Option B. Leave the wheelchair unlocked for easier movement. Option C. Lock the wheelchair and use proper body mechanics with assistance as needed. Option D. Ask the patient to jump to the table. The correct answer is option C. Lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. Pulling can injure the patient and the assistant. An unlocked wheelchair can roll and cause a fall. Jumping is unsafe and unrealistic for a transfer. Question 84. To protect safety in an urgent care office, a capillary puncture is needed on an adult finger. Which side is generally preferred? Option A. The center of the thumb pad. Option B. The side of the middle or ring finger pad. Option C. The little finger near the bone. Option D. The tip of the index finger. The correct answer is option B. The side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The thumb is often calloused and has a pulse, making it less preferred. The little finger has less tissue over bone and is usually avoided. The index finger is commonly used for touch and may be more sensitive or calloused. Question 85. While working in a quality control review, lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A. 4th intercostal space at the left sternal border. Option B. 4th intercostal space at the right sternal border. Option C. 5th intercostal space at the left midclavicular line. Option D. Left arm below the clavicle. The correct answer is option B. 4th intercostal space at the right sternal border. V1 belongs at the 4th intercostal space on the right side of the sternum. That location corresponds to V2. That location corresponds to V4 in standard placement. The left arm electrode is a limb lead site, not V1. Question 86. An office review in an exam room shows that a small fire starts in a trash can at the clinic. Which acronym guides the initial fire response? Option A. NPO. Option B. SOAP. Option C. PRN. Option D. Erase. The correct answer is option D. RACE. RACE stands for Rescue, Alarm, Contain, and Extinguish or Evacuate depending on policy. NPO means nothing by mouth and is unrelated to fire safety. SOAP is a documentation format and does not guide fire response. PRN means is needed and does not guide emergency fire response. Question 87. Before the visit continues in a patient intake station, a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A. Use the instruments if the package is dry. Option B. Write a new date on the package. Option C. Reprocess the instruments before use. Option D. Open the package and rinse the instruments. The correct answer is option C. Reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. A dry package alone does not override an expiration policy. Changing the date without reprocessing is unsafe and misleading. Rinsing does not restore sterility. Question 88. Given the workflow in an internal medicine office, an assistant is unsure how to handle a chemical disinfectant spill. Which resource should be consulted? Option A, Insurance Remittance Advice. Option B, Safety Data Sheet. Option C, Patient Intake Form. Option D, Appointment Reminder Template. The correct answer is option B, Safety Data Sheet. The Safety Data Sheet gives hazard, handling, storage, and spill response information for chemicals. Remittance advice explains payment decisions, not chemical hazards. An intake form does not provide chemical safety instructions. Reminder templates do not address workplace chemical safety. Question 89. For a patient encounter in a telephone triage workflow, a medical assistant prepares to administer an injection. Which set best represents medication rights? Option A. Right patient, right medication, right dose, right route, right time, and right documentation. Option B. Right insurance, right copay, right appointment, and right room. Option C. Right color of vial and right storage shelf. Option D. Right diagnosis only. The correct answer is option A. Right patient, right medication, right dose, right route, right time, and right documentation. The medication rights are safety checks used to prevent administration errors. Administrative details do not replace medication safety checks. Vial appearance and shelf location are not sufficient medication rights. Diagnosis alone is not enough to confirm safe administration. Question 90. The care team in a patient education session asks for guidance because the pancreas is discussed during patient education. Which hormone is associated with blood glucose regulation? Option A, thyroxine. Option B, melatonin. Option C, insulin. Option D, estrogen. The correct answer is option C, insulin. Insulin is produced by pancreatic beta cells and helps regulate blood glucose. Thyroxine is a thyroid hormone involved in metabolism. Melatonin is associated with sleep-wake cycles. Estrogen is a reproductive hormone and is not the main pancreatic glucose hormone. Question 91. A medical assistant is working in a treatment room when the assistant identifies an abnormal rhythm on a tracing after it prints. Which action is within the medical assistant role? Option A. Give the tracing to the provider promptly according to protocol. Option B. Discard the tracing to avoid alarming the patient. Option C. Change the tracing to make it look normal. Option D. Diagnose the rhythm for the patient. The correct answer is option A. Give the tracing to the provider promptly according to protocol. The assistant may recognize urgency and route the tracing, but interpretation belongs to qualified clinicians. Abnormal results must not be hidden or discarded. Altering medical records is unethical and unsafe. Medical assistants should not provide a cardiac diagnosis. Question 92. When a patient encounter unfolds in an administrative check-in area, lead V4 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, 4th intercostal space at the right sternal border. Option B, 5th intercostal space at the left midclavicular line. Option C, a midway between V2 and V4. Option D, a 4th intercostal space at the left sternal border. The correct answer is option B, 5th intercostal space at the left midclavicular line. V4 is placed at the 5th intercostal space along the left midclavicular line. That location is used for V1. That location is used for V3 rather than V4. That location is used for V2. Question 93. Given the workflow in a certification exam scenario, a used needle must be discarded after an injection. Which practice is safest? Option A, place the needle in regular trash. Option B, recap the needle with both hands. Option C, activate the safety device and place the needle in a sharps container. Option D, carry the needle to the front desk for disposal. The correct answer is option C, activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Sharps can injure staff and must not go into regular trash. Two-handed recapping increases needle stick risk. Transporting exposed sharps through the office increases risk. Question 94. At the start of care in a quality control review, an intramuscular injection is ordered for an adult. Which site may be used according to protocol? Option A, a reddened rash site. Option B, inside a visible vein. Option C, deltoid muscle when the medication and volume are appropriate. Option D, the fingernail bed. The correct answer is option C, deltoid muscle when the medication and volume are appropriate. The deltoid can be used for certain adult intramuscular injections when volume and medication are suitable. Irritated or infected skin should generally be avoided. A vein is used for intravenous access, not intramuscular injection. The fingernail bed is not an intramuscular injection site. Question 95. When a patient encounter unfolds in an internal medicine office, the provider asks for an instrument to examine the ear canal. Which instrument should be prepared? Option A, spirometer. Option B, speculum for pelvic exam. Option C, ophthalmoscope. Option D, otoscope. The correct answer is option D, otoscope. An otoscope is used to inspect the ear canal and tympanic membrane. A spirometer evaluates lung function rather than the ear. A vaginal speculum is not used to inspect the ear canal. An ophthalmoscope is used to examine internal eye structures. Question 96. Given the workflow in a treatment room, a provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A, prone position. Option B, lithotomy position. Option C, Fowler position. Option D, Trendelenburg as the only routine choice. The correct answer is option C, Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Prone places the patient face down and may worsen breathing comfort. Lithotomy is used for pelvic procedures and does not primarily support breathing. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Question 97. In a diagnostic testing area, a medical assistant leaves a computer screen open with patient information visible. Which safeguard would help prevent this issue? Option A, keep the screen facing the waiting room. Option B, lock the workstation before stepping away. Option C, share passwords with trusted co-workers. Option D, disable audit trails to speed workflow. The correct answer is option B, lock the workstation before stepping away. Locking the workstation protects electronic protected health information from unauthorized viewing. Visible screens increase privacy risk. Shared passwords weaken accountability and violate security practices. Audit trails support security monitoring and should not be disabled by staff. Question 98. To protect safety in a diagnostic testing area, a urine culture is ordered for a patient who can void independently. Which collection method is most appropriate? Option A, random sample from an old urinal. Option B, specimen collected from the toilet bowl. Option C, clean catch midstream specimen. Option D, first drops of urine into an unclean container. The correct answer is option C, clean catch midstream specimen. A clean catch midstream specimen helps reduce contamination from skin or genital flora. Old specimens may be contaminated and may not reflect current results. Toilet water contaminates the specimen. Initial urine can carry contaminants and an unclean container is inappropriate. Question 99. After reviewing the situation in an exam room, a medical office uses a policy and procedure manual. Which purpose is most accurate? Option A, guarantee every claim is paid. Option B, provide standardized guidance for office tasks. Option C, replace all state laws. Option D, eliminate the need for training. The correct answer is option B, provide standardized guidance for office tasks. Policies and procedures help staff perform tasks consistently and safely. Policies do not guarantee pay or reimbursement. Office policy cannot override applicable law. Policies support but do not replace staff training. Question 100. Following office protocol in a medication administration visit, a peak flow test is ordered. Which body system is being assessed? Option A, integumentary system. Option B, respiratory system. Option C, urinary system. Option D, skeletal system only. The correct answer is option B, respiratory system. Peak flow measures how quickly air can be exhaled and is related to respiratory function. The integumentary system involves the skin, hair, and nails. The urinary system is assessed with urine tests and related procedures. Peak flow does not measure bone structure.